Hello, this is Dr. Valli Parthasarathy over at Synergy Behavior Solutions, and I'm here with Sarah McClowdry, our Training and Behavior Coordinator, and you're joining us today for A Dose of Behavior with Dr. Valli. So welcome. I think that we're going to talk a little bit today about credentials and certifications and things that people talk about a lot in the training world sometimes.
So there's lots of different types of people out there that train dogs. And I think we wanted to first kind of maybe talk a little bit about some of the terminology that people use and what that means and who can use those terms. So let's kind of talk about trainers or people who call themselves trainers first.
Yeah. So training is actually a really unregulated field. That's the first thing to know. We wouldn't expect it because trainers are oftentimes doing some really complicated things and working oftentimes with some animals who have a lot of pretty significant behavior problems, and there are a lot of trainers who do a really great job. It's important to remember, though, that it's an unregulated area. So what I think about is, thinking about what credentials are available for trainers. There are many different words and terms that are out there, like Sarah was talking about. Trainer is one of them, behaviorist is another. And I wanted to talk a little bit about what it means to be a behaviorist, what it means to be a veterinary behaviorist, what it means to be a veterinarian, and maybe starting first with veterinarian, just because that's one that everybody knows for the most part. And so veterinarian
between a veterinarian versus a vet behaviorist versus a veterinarian maybe who is interested in behavior.
Sure. Veterinarians, of course, are involved with the medical side of animal care. And it's required that they go through schooling. They have we have a veterinary degree. We have to go through a certain amount of continuing education to try to keep up to date with all the changes that are happening. And as we know, science is changing everything almost every day. So we try to do our best to keep up with the different areas of medicine that are out there. And different veterinarians are going to form different interests. So there are some veterinarians who are fantastic at general practice, and that's what they love. They love being the first line of seeing these puppies, seeing the kittens, working with the family pets, building that relationship over the long term with people and their pets, and really getting involved with helping in the first lines. Then we have also people who go into specialties. So that's sort of the path that I'm taking right now in behavior. And there are a whole lot of different specialties in veterinary medicine, including internal medicine, cardiology, neurology, ophthalmology,
emergency
medicine, just to name a few. And these are people who have these are veterinarians who have gone into further, more detailed study and become board certified. So veterinarians have these certain regulations on them that are put upon by the state. So for example, we have to have a veterinary patient-client relationship which is kept up to date. And at minimum, it means that we have to see a patient once a year to be able to do that. However, depending on the veterinarian and depending on the medical condition that they're treating, that can vary. So for example, when I was in general practice, if I had a pet coming in who had an ear infection, I might treat the ear infection and then recheck the dog or cat in 2 weeks. In behavioral cases, it might be 2 months. So it really depends on the type of medicine that you're practicing and the type of conditions that you're working with. With board certification, there is a certifying body that you get involved with, and you go through a residency program. And so I just completed my residency program, and through my residency program, I saw about at least 475 cases that were reviewed by my mentor, and then that was over 2,700 case hours worth of work. And in addition to that, additional training and education in various areas of neurobiology, behavior, psychology, re-looking at the integration of various physical systems and how they all integrate back in. And of course, looking at the behavioral medicine and being more involved with that. So the things that make me different from a general practitioner, say, is just the level of immersion that I have in behavior and looking at how all the physical systems interact to impact behavior. And also my comfort level with using behavioral medications. So those are the different things that I do. Now, I can't call myself, ethically, I can't call myself a veterinary behaviorist because I have not yet sat boards. Once I sit boards and pass boards, then I can call myself a veterinary behaviorist.
But what's interesting with you, even different than some of the other vet behaviorists out there, is you also have a PhD that was in behavior before, I believe, before you went to vet school?
Yes. So, yes, my path here has been very long and convoluted, but yes, I do have a degree in a PhD that was in behavior before, and much of that was looking at normal and abnormal behaviors in dogs and cats and birds and horses, and being able to recognize what's normal and abnormal, and also getting some, and I also, during that time, I also got some base knowledge on the medications. And this was actually before I went to vet school. So I already had a strong interest in behavior before going into vet school. So veterinarians do have regulations that we need to follow. So there is a regulation within the veterinary field. For veterinary behavior, while I could call myself that, it's not considered ethically appropriate. So there is sort of internal regulation associated with that. Now, in the training field, pretty much anybody can call themselves a behaviorist. There's no regulation per se, no legal regulation for who can call themselves a behaviorist and who can't. There is a certification body called the Animal Behavior Society that does certify people or certify people who have a certain background in behavior, whether it's a PhD or a master's. And so they can call themselves behaviorists. But apart from that, really, there's no other guidelines for someone to call themselves a behaviorist at this time. So that leads to problems sometimes, or confusion, because there are a lot of trainers who call themselves behaviorists because they work with behavior problems. So it's a very general term that doesn't necessarily have a particular qualifications behind it.
And then, but traditionally, people who maybe would have a master's degree or a PhD in a behavior-related field, I think ethically that's looked on for them to say that they are behaviorists a little more, people are usually a little more comfortable with that.
I'd say that that's probably true.
Yeah, than somebody who just trains pets.
And the idea behind that, I think, is because they have a greater background in some of the research and some of the education that's behind both the ethology of why it is that animals do what they do, and also the learning theory behind what it is why animals act the way that they act.
But you don't have to have those backgrounds to be an amazing dog trainer or cat trainer or horse trainer or whatever. You just shouldn't be calling yourself that. So on the training side of things, there is also a wide range of certifications. There's it used to be that there were not really any schools, but nowadays there are some places to get education and continuing education. So I want to talk from a veterinary side of things. What would you look for in a trainer, certification wise or things like that?
So, from a certification standpoint, I definitely would look for certifications that are evidence-based. So looking at programs that are using what is known scientifically as well as experientially about training and behavior modification. I would love, and there's different programs that do this, but I would love to have one that's more hands-on. And if not hands-on, something that has a lot of maybe video review of people training animals, and so that the instructor can give them feedback on what they're doing well and what they're doing and what they're not doing well, because there's definitely a difference between understanding the concepts and being actually able to put it in practice. So being able to see that and be able to give feedback on that, I think is really important.
And not only putting it in practice, but also being able to articulate it to the client. So that becomes a big issue too, is we always say that we're not just training pets, we're training their people too. And that's, I think, one of the biggest myths coming into dog training. I think people think that they're just going to get to train dogs all the time, but we're really doing a lot more people training than dog training sometimes.
Right, because these pets go and they live with their people, and so the people need to be able to communicate with them in some way. My preference from being a behavior professional in veterinary behavior is that, looking for programs that focus on the use of setting antecedents and setting the environments so the animals are being successful, and using primarily positive reinforcement as the way that they train. So looking at setting them up for success and rewarding the behaviors that we want. And there's so many behaviors that we can change through those two things that we really don't need to go further down the road of doing a lot of corrections or scolding or things like that. So looking for programs that's what their focus is on. There are a couple of different ways that I've said. There's some organizations that are fully that they don't want to talk about anything corrective at all. There are others that say, yes, it exists, but we're not going to use them. There's the Lima principle, the least invasive. That just went backwards on me here. But least invasive, minimally aversive methodology for any particular problem. So those are a few of the things that I think about when I'm looking at it.
And what's interesting is I personally am certified through the certification for pet dog training, CPDT, and I have what's called the KSA, which is the Knowledge and Skills Assessed designation. And that is a designation where you do have to submit video to be reviewed of teaching the dog. So that is a step beyond just the knowledge, the KA, the knowledge assessed. But they also, I know, do offer some more behavior focused certifications. And also Pet Professional Guild now has some certifications. And there's such a wide range. It's hard to keep track of all of the alphabet soup that can come behind a trainer's name. Dr. Valli always teases me that I like to collect letters behind my name. So,
the alphabet soup is definitely its own presentation. It's a presentation I've given before.
Yeah, and it's really hard for, I think, the average pet person to read through what alphabet soup means. And I think for me as a trainer, one of the things that I'm always looking for in fellow trainers to refer to or to teach classes, things like that, when we're looking at our facility, is I look for continuing education. I want a trainer and actually a veterinarian, because they need continuing education. I want to see that they're actively doing that continuing education, not just to meet the requirements of their certification body, but really because they want to continue to learn. Things are changing so much. I think about, I've been a trainer since professionally since 2004, and things that I did back then, I probably would not do now. And even I think about things I did 5-6 years ago, I would definitely approach things differently. And that's because I continue to grow and learn and educate myself through continuing ed, meeting with other trainers, doing that kind of stuff. And I think that's what for me is the most important. I want my vet, when I come in, to talk to me about this amazing, certification or, continuing education program that they went to on whatever they're most interested in, and so I want to see that desire to keep learning and to keep growing as a professional.
Yeah, I think learning beyond the minimum is definitely a good way of thinking about it. And I know that when we look for trainers, and other support staff, that's definitely something that we're looking for. Who are those people that are thirsty for knowledge?
Yes, yeah, thirsty for knowledge is sure. And I think it's so reinvigorating when we're having times where Especially now, some days it's hard to be a dog trainer because I miss seeing dogs in person. I realize that I like seeing people and dogs. So I think a lot of veterinarians are the same way. And so definitely with COVID, things have been a little different, but
yeah,
we need to go forward with that.
Yeah. So, there's a lot of different, like Sarah was saying, and like I was saying, there's a lot of different certifications out there. If you have a trainer that you might be interested in working with and they have various certifications, take a moment to Google it. Yeah. See what that certification is. See what sort of background that is. Is it something that is evidence-based? Is it something that is, or is it not? Or is it something that maybe you ask your veterinarian, is it something that they recognize? See if if you have any other training, people who are in the training field that you might know, see if that's something that they know. So I think it's definitely worth asking around. Yeah. And ask the trainer. Yeah.
Yeah. Ask the trainer, why did they choose to get a particular certification? If you were to ask me what my FitPaws Master Trainer initials mean after my name, I would talk to you about how important I feel that the whole body affects behavior and to look at the whole dog. And so that's one of the reasons why I went and got the FitPaws Master Trainer certification for looking at fitness and making sure that our dogs are healthy and structurally sound when we're doing training and asking them. So I would love it if someone asked me why I have particular certifications, because it means those certifications mean a lot and have usually just like, I don't want to belittle vet behaviorists by any means, but all of us who do any type of certifications, it means a lot to us. And we put a lot into it no matter how much we have to. And I think asking people why did they choose to go that route? I think it can be very eye-opening, good or bad, and help you decide which trainer you would like to work with.
Mm-hmm. Yeah, definitely. My goal or my reason for going into veterinary behavior was because I really wanted to help these patients that were really just having a lot of challenges, and helping the parents who are having a lot of challenges, and just knowing that before I went into veterinary school, just knowing that there was a larger number of patients that I could help if I went this direction. So ultimately that's where I ended up.
How many vet behaviorists do we have in this country right now?
Oh, I haven't kept track recently. I don't think we have more than 80 yet.
Okay, there you go.
I don't think. So but we're probably going to be breaking that soon. So
good.
There are more and more veterinary behavior residents, which is really cool, because veterinary behavior is not, it's still a relatively new specialty, and it'll be so nice to have more available to everybody. So I think it's going to be cool.
All right. Well, if anybody has any questions regarding certifications or what people call themselves as dog trainers, etc., please feel free to leave some comments on the Facebook page, and we can chat a little bit more about this. And if you have any ideas of things that you'd like us to speak about on our Dose of Behavior with Dr. Valli, that's maybe a little more vet focused than our trainer talks, please feel free to leave those comments too. We're always looking for new ideas. This was brought up by another trainer recently who was dealing with some frustration out of people who call themselves different things. So thank you for that. And I'm Sarah McLeodry.
I'm Valli Parthasarathy, and look forward to seeing you next week.
Have a great day.
Bye-bye.